All right, if you're looking for a safe and effective alternative to orthopedic surgery, this could be for you. Joining us now is Melissa Golden, the director of StemCellix. Now, she has everything you need to know about how stem cell therapy is accessible and affordable. Yeah, you heard right, affordable. And with her is Mark Norton, and he has actually tried this therapy before. And Mark, we're going to get your story in just a second. But Melissa, for those who don't understand what stem cell therapy is, what is it and how does it work?
Okay, so everyone is comprised of cells. You have bone cells, ligament cells, heart cells, lung cells, and stem cells are a rudimentary form of cell that when they divide, they can either turn into another stem cell or they can turn into one of those other types of cells like bone, ligament, cartilage, heart, lung. So when we take them out of an area of storage and inject them into an area where there's degeneration or dysfunction, they can actually regrow tissue. Right, so stem cells are kind of like college students who haven't decided their major yet, right? So they can turn into a different type of cell, which is why they're regenerative.
Very cool. Okay, so Mark, you had pain, from what I understand, in not one, but both shoulders and in
left bicep.
Your left bicep. Now, how long had you had this pain?
Well, I had surgery almost 14 years ago on my right shoulder for a torn cuff, and it was good for a couple years after that. But it's been about the last year and a half that I had starting to have problems when I was sleeping, when I was lifting weight, doing pretty much anything.
Were you lifting too much weight? Is that what aggravated it?
No, absolutely not. I'm not.
You're kind of a lightweight.
I'm not too worried about it. I just want to keep healthy.
Yeah, of course. So you're lifting to stay lean and not to necessarily grow muscle mass. So you had this pain, and then you went and you had the stem cell therapy. And what was that process like for you? Was it painful at all?
No, absolutely not. I mean, you're awake during the entire process. When I went to the clinic, they first take the draw from your storage. I like that storage area. It's a fat area. And they spin it down for a couple of hours, and then they can inject the stem cells into the shoulder where the torn cuffs were at.
Right.
And they use PRP, which platelet-rich plasma, into my left bicep because it was a torn muscle. I guess she was explaining that it's a little bit different how that works.
Right. And so how soon after that did you get relief?
I mean, relief was almost immediate because I wasn't lifting, so I couldn't do anything for that first week. And then she said to start very slowly with very light weight after that second week. And from then on, I was just able to do everything I was comfortable doing. I could lift weights, I was sleeping a lot better.
So you're back to normal?
Absolutely.
That's fantastic. Now, what is the success rate? Is everybody like Mark and they see almost immediate results?
So you can't regrow tissue immediately. To amend that tear, it takes some time. But what he's explaining is there's an immediate anti-inflammatory effect, both from the PRP and from the stem cells, and that can cause significant pain relief and reduction in symptoms almost immediately. The success rate of significant tissue regeneration is 93 to 95%.
Wow.
Yeah, depending on the severity of the problem and the actual condition.
That's a really good success rate. So we're talking about shoulders here, a bicep. What other conditions can you treat?
So we can treat more than just orthopedic, but since this is more geared towards the orthopedic realm, we're looking at torn rotator cuffs, torn meniscus, osteoarthritis, degeneration, bone on bone.
Wow.
We can actually regrow cartilage and regrow tendons and regrow ligaments and connective tissue within those joints.
Now, I know right now insurance doesn't cover this. Is this an expensive process?
Stem cells have this stigma of being incredibly expensive and just not accessible to people, but it really is. So we have lots of programs, and we can get payments around $100 a month because our goal really is to treat as many people as we can and provide the treatment to everyone who needs it.
Fantastic. All right. And you can visit the StemCellix website at StemCellix.org to schedule a free consultation with their orthopedic specialist, or you can give them a call at 813-938-7034. And Melissa Golden and Mark Norton, thank you so much. Glad you're feeling so much better. Appreciate all the good information. Daytime will be right back. Stay with us.